Some of the more than 50 million Americans with arthritis may benefit from new research on pain treatments. Data published in the New England Journal of Medicine shows the popular arthritis painkiller Celebrex is not as risky for your heart as suspected. The study found Celebrex is just as safe as drugs like ibuprofen and naproxen. CBS News medical contributor Dr. Narula is a cardiologist at Lenox Hill Hospital in New York. Good morning.
Good morning, Nora.
So what have we learned new here?
The important thing is that to understand this, you have to take a look back. In the 1970s, we had ibuprofen and naproxen that came on the market as NSAIDs, and these were really revolutionary in terms of helping patients with pain from arthritis and other conditions. The problem is they had gastrointestinal side effects, GI upset, GI bleeding. So step into the arena in the late 1990s, the selective NSAIDs, the COX-2 inhibitors, Vioxx, Celebrex, Bextra. The problem was that within a couple years, we started to see increased cardiovascular events like heart attack and stroke. That led to Vioxx being pulled off the market in 2004, Bextra being pulled off in 2005. Celebrex was the lone COX-2 inhibitor left on the market with a warning label and a plan by the FDA to study the drug over the next 10 years. And that is where we're at now.
So what are they saying now?
So now, this was a large study, 24,000 patients over 10 years, patients with osteoarthritis and rheumatoid arthritis who took daily prescription doses of either Celebrex, ibuprofen, or naproxen. What they found is that in moderate doses, Celebrex is what we call non-inferior to the other two drugs, meaning that all of these patients had a roughly 2% chance over 30 months of some sort of cardiovascular event. Celebrex also had less gastrointestinal side effects and less renal or kidney effects than ibuprofen.
Can you just back up a second about arthritis? How do you know if you have arthritis and maybe you're just getting older and your bones are a little tight?
Well, that's a good question. And you would need to see a doctor to discuss.
So it has to be diagnosed?
Yes, it does. Yes.
That's what I was wondering. It has to be diagnosed.
Yes, because there's lots of conditions that can cause pain. But what we're talking about is not the types of doses that you would take from an over-the-counter Aleve or Motrin or ibuprofen or Advil. These are prescription doses that are taken daily, chronically for years.
Does it affect you if you have a heart condition?
Well, that's in 2015, the FDA did update its regulatory warnings on all NSAIDs. So this, as an entire class, these agents do increase risk of cardiovascular events. They can increase risk of high blood pressure, of heart failure. So the recommendation really still is that you do need to be cautious. Take the lowest dose for the shortest amount of time possible. But what's nice is this really does offer a potential another option for patients who may have been afraid of this class of drugs. There were some limitations to this study. I think it's important to note a quarter of the patients were 27% lost to follow-up. We don't know what happened to them. 63% or so stopped taking the drug, which is a normal amount for pain studies, but still, it influences how we interpret the data. And also a lot of patients who were on aspirin, we don't know what that did because that affects ibuprofen and naproxen as well.
That's some good news for people who
have arthritis. It's important.
Yeah,
Definitely.
so thank you, Dr.
Thank you.
Narula. Always good to have you here.
I second that.